Hi, my name is Dr. Tosin Odunsi, and today we're going to be diving into some of the most personal and deepest questions people have about managing faith and medicine. These aren't easy topics, but it's important to discuss these openly and honestly. So let's get started. The first question is, if I have faith in healing, does seeking medical management mean I lack faith in God? Seeking medical management does not mean you lack faith in God. It means you are seeking wisdom. Wisdom means that you are introspective and you understand that you have a gap in knowledge. By seeking medical care or speaking with physicians or the experts in the field, that means you're trying to close that gap in knowledge and make a wise choice about your body, your health. So please don't think that if you go to a doctor, you don't trust God. I believe that when you go to God and He is instructing you to take care of yourself, seeing a doctor, exercising, lifestyle modification, things like that, that means that you are demonstrating wisdom. Question 2 is, what do I do if my doctor's recommendations conflict with my religious beliefs? This is a great question because I have patients who have different beliefs that don't align with a medical recommendation that I have. For example, Jehovah's Witnesses, I ask them if what their views are, what their beliefs are in terms of receiving blood products. And the reason why I ask the question like that is there may be a life-threatening situation where I need to give a patient blood, and the patient has every right to change their mind at any point. They may come to the hospital stating that they don't want to receive blood products. They can change their mind at any point in their care. So I am very respectful of different views, different beliefs, and I want you to be comfortable bringing those up with your physician. And the final question is, how do I handle the pressure of my faith community if they don't agree with the medical management that my doctor is recommending? This is an excellent question and probably sensitive, especially if the members of your community are also family members. I would recommend having a conversation, if you're comfortable, with those members of the community. You don't have to dive into the ins and outs of your medical condition or everything the doctor says. However, having some medical knowledge may help with building that understanding of what's going on with your body. So if you're comfortable and your doctor has been able to explain what's going on with you and why they recommend a treatment or a management option, please explain that to the community members. Sometimes there is friction because there's a lack of understanding. Now, if there continues to be a disagreement about the medical management, ultimately, it is your decision because it is your body. So after discussing the reasoning and some of the medical knowledge that the person in the community may need to understand what's going on, it's ultimately your decision, and you should feel confident and comfortable making that decision because you're in the relationship with the physician and you've weighed all your options and come to a choice that's best for you. These questions are tough because they touch on what matters the most: your health and your faith. It's okay to seek guidance and help when you're navigating these difficult questions and your body. Always know that you're not alone. I'm here for you, and I'm a physician. I'm an OBGYN who is also a believer and has a strong faith. If you like topics like this and you want to hear more and get to know me a little bit better and how I navigate faith and medicine, go check out my Instagram page. It's called Life by Tosin, and I love talking about this. I'm passionate about it. And if you like videos like this that are educational and we tackle difficult topics and have a conversation about real women's health issues, I want you to hit that subscribe button, and I will see you in the next video. Bye.